Mai ka hau mai a ka makani. Hue huale a e nahi hua ali. The wind blows and the tiny seed is swept up across the land. Over the last few years, we have experienced unprecedented challenge and change. Just like the wind that blew the seed and scattered it all over here and there. Imagine being a medical student, a pharmacist in training, a graduate student in social work, or a young psychologist in the making, standing, looking out at the career you dreamed of, and seeing the healthcare landscape as it is today. You wanted to help people, to serve. And thinking about doing that now is daunting because the needs are vast. There weren't enough health professionals before 2020. And the folks we do have, they're stretched, exhausted, and worn out. And the thought of joining them feels like a very different promise than it did just a few short years ago. So what are we to do? Well, we begin with what we already know. Kauli'ili'i kaloa me kalaulai. Loku iho ka hao mai rapo. Pola, pola e kahi huai tawailani. We know that we need to prepare our health learners for the work they face. And not think that they're supposed to suddenly magically know how to do that without getting burned out. We know that we need to be healthy to heal. And the good news is that we know how to do that by combining years of research and service in our respective disciplines with the indigenous wisdom of the First Nations. It's actually quite simple. We teach them how to play well with others, to work as a team, and we teach them resilience. I'm a psychologist by training, and I run a nonprofit organization whose focus is service and training in medically underserved Native Hawaiian and rural communities. Not the idyllic vacation postcard Hawaii, but the real one, the land of my ancestors, where the divide in income and access to housing and adequate health services is wide and widening, and where the resilience of our people is earned through struggle and challenge. The healthcare providers I work with, they understand scarcity. And they know that we've got to bring every tool we can and every hat they can find in the closet together to meet the needs that we see ever growing in our community. So when my team and I go to the Home Project, a mobile outreach clinic that services houseless communities, we know that we need to train our learners how to work in an integrated way, so that they learn to rely on one another right from the start. Medicine, pharmacy, social work, psychology, all bringing everything together to take care of the patient's needs. So that when they meet a patient like Kaimana, a Native Hawaiian man who has uncontrolled diabetes and is houseless, they can bring together a whole host of tools that he might need. For example, he might need a medication adjustment, or education about diabetes. He might need help with access to resources or healthy foods. Or maybe it's wound care, or help with motivation, or maybe just support for his own resilience. We understand that our health providers can be taxed by over and over and over again providing care in a challenging system. So we developed a resilience curriculum. What we did was we pulled together tools and strategies that were helpful both for the emerging health professional to learn, but also the patients they served. It turns out the tools are the same. And so we teach them beginning with showing them about the importance of balance. And we teach them tools in effective communication and motivation. And we teach them about leadership in times of crisis because we know that they must be ready for what the healthcare system and life demands of them. And we do all of that by teaching it in an integrated way so that they see the model in action while it's happening. So that then when they are trained and later practice, they know how to stay balanced. O ka puka ela no ia o ka mu o e kupuana ho'ia mohalai. I ka helu a ka la, i ka vai o ka opuai. I pua no ke a'ali'i, ke ehia e tauai. As the sun scratches the earth in the rain, the shoots burst forth and flower. Once these health learners are trained, they emerge better prepared for a long career in healthcare with a stable and vibrant health system. And then they, in turn, train others and still others until the whole system is transformed. Now that's the big idea. Ma hua hua mano mano alei. The buds bloom and grow strong and abundant and begin the cycle again. We come from a small place, but this work is universal, readying and steadying the healthcare workforce so that they can care for all of the kaimanas out there as they care for themselves. The cycle begins again. Learners become leaders. And if each of us, in our own little corner of the universe, can tend to the cycle and take care of each other in the way we are all best able, then the world just can't help itself but become a better place. And what's a bigger idea than that? E leiana I ke a'ali'i kumakani e. Aloha no.